New research this morning claims millions of children get antibiotics they don't need. The American Academy of Pediatrics says they're being prescribed twice as often as they should be for children with respiratory infections. The study estimates 11.4 million antibiotic prescriptions each year are unnecessary. Our Dr. Holly Phillips is with us this morning. Good morning.
Good morning, Nora.
So tell us what this study found out.
You know, this study really looked at data on thousands of kids that had common respiratory infections that can be caused either by viruses or bacteria. These are things like sore throats, ear infections, sinusitis, even some bronchitis symptoms. And they found that about 27% of the time, these infections are caused by bacteria, in which case antibiotics will help. But in 57% of cases where kids were brought to the doctor with these symptoms, they were prescribed an antibiotic. So basically, that's more than twice as many antibiotics as should be prescribed, which is never a good thing.
It seems like we're always hearing stories about kids being overprescribed, but what makes this one different?
Well, you know, this really gives us numbers. Absolutely, we know antibiotics is overprescribed. This gives us really a sense of how significant the problem is.
Why is it happening?
You know, the bottom line is it's actually very difficult to tell whether or not an infection is caused by a bacteria or a virus. It's an imperfect science. So in the office, we have a few tests we can use. For instance, for sore throats, we have a strep culture or a swab that can give us sort of a scientific answer. But most of the time, doctors, we have to take an educated guess. We look at how severe the symptoms are, how long they've lasted, and we do some physical exam in the office, and we basically have to guess. This study is suggesting that sometimes, at least half the time, we guess wrong.
Right, and a reminder about how harmful antibiotics can be in the long term with this overprescription of them.
Absolutely. You know, that's really the main reason we're seeing the emergence of superbugs. These are bacteria that are resistant to all antibiotics. Kids can also have just common adverse reactions. That's nausea, stomach upset, severe allergic reactions. Antibiotics really are not completely benign drugs.
Thank you, Dr. Holly Phillips.